Hello beautiful souls, it is me, Nurse Meg from nursemegrn.com. This video is going to be all about the dreaded Code Blue. So first, really quick, a little bit of introduction. I am Nurse Meg and I have been a nurse for 12 years. My entire goal in life is to revolutionize this next generation of nursing. I create free printouts and resources for nursing students and for brand new nurses with less than 5 years of experience. So today's video, I'm actually going to be reading directly from one of my courses. My big main course is called the New Nurse Survival Guide. It's literally everything you need to know that maybe your preceptor didn't teach you within your first 5 years of nursing. How to talk to doctors, scripts on how to talk to family members, how to give the most perfect report, how to, be confident in a code is another one, common labs and tests explained and why doctors order them, all sorts of stuff like that that you wouldn't necessarily learn unless you work and learn the hard way. And I don't want you to learn the hard way because I want there to be nurses in the future. So that's why I wrote that course, the New Nurse Survival Guide. If you want, I'll put a link down below in the description so you can kind of check it out and see what's in it, and maybe it's for you. So let's get started. I'm going to be peeking to the side of the screen to look at the course that I have open on my laptop, all about how to be confident in a code and how to run a code blue. So this is kind of like from the nurse's perspective of your patient is coding, as well as you are a nurse, a runner coming to help in the code blue. The number one thing that you should know in any code setting is how to call a code. Every facility is going to be different. A lot of them give you a little badge, and on the back it's going to tell you, dial these 4 numbers, press pound, and then ask the operator to call a code blue to such and such room. Be very familiar with it, practice it, know how to call a code, because when you're in a situation where seconds matter, you cannot delay to look it up or to ask somebody. You gotta know. You have people's lives on the line. A lot of newer hospitals have a code blue button in the room where you could just pull a cord or press the button and it will automatically call a code blue. It'll set all the alarms off and people will come to help. All right, so nursing school doesn't really teach you what to do in a code blue, and also maybe your preceptor did not teach you exactly how to run a code blue. It's kind of hard to learn without actually experiencing it, but I'm gonna give you 10 steps on what should happen first in a code blue setting. So this is everything that should happen in the first couple minutes of a code. If you can delegate these things, you will be set up for success. You will also look like the most impressive nurse on your floor, especially if you're new. If you're able to delegate these things, whether it's your patient or not, because some nurses get really flustered when it's their patient and they just want to have their papers and be a resource and everybody else do everything. So if you can step up and delegate these 10 things to people, you are going to be so impressive. You are going to look like such a badass nurse on your floor. Okay, so let's get started. These are the top 10 things that need to be done within the first couple minutes that need to be delegated. Number 1 is obviously their code status. If they're DNR, let them peacefully pass to the next level, to the next side, whatever it is. But if they are not, they are a full code, let's initiate compressions. Place them on the hardboard, elbows locked when you're doing compressions. Remember, hard and fast. But yes, always double check the code status. That's number 1. Number 2 is tell someone or do it yourself, bring the code cart in. Whether you're going to use it or not, bring it right by the door. I know some facilities have a policy where if it's brought into the room, technically it's used. I think they're phasing that out now because everybody has those little clips on the code carts. So bring it in. If you think you're going to use it or not, don't open it until you need it. Number 3 is record. Get those forms that are always on top of the code cart, hand it to somebody or ask who's recording, hand it to them. They should have a pen in their pocket or something like that. Start recording. Number 4 is life pack. Hook that patient up to the life pack immediately so you can see their heart rate, their rhythm if they're not on a monitor, and then if they're super bradycardic or if the rhythm looks a little funky, a little V-tacky, put the defib pads on right away, okay? So after a code, I think it's every new nurse's responsibility to go and play with the life pack. So when the code is completely over, maybe the patient has left the room, whatever happened, go play with the life pack. learn the life pack. You really need to get familiar, press some of the buttons, you know, do it with a more seasoned nurse so you can get the feel of it, because you want to feel very comfortable with that life pack in case you do need to use it. Also, explore all the drawers of the code card that have been opened. Okay, so every facility is a little bit different, but it's usually first drawer has the epi, and then the last drawer is all the respiratory stuff, because it's usually the biggest one. But explore your facility's code cards, know them. Take pictures if you're allowed to. Just know your code cards, because one code card is going to look exactly like the other code card in your facility. Okay? All right. So where were we? Number 4 was life pack. Number 5 is Airway. Put the patient on O2, a venti mask, a non-rebreather, whatever they need, and then if things are pretty dire, go ahead and set up suction in the room, and have somebody delegate to somebody for this number 5 to be the respiratory helper. Assist the respiratory therapist, help ambu bag and suction, all that stuff. But you should have a respiratory therapist that will come to the code. But have a nurse helping that person, getting supplies for them. You know, it's a 2-person job. Number 6 is vitals. Quickly, get a set of vitals, including temp and blood sugar. Okay, so vitals within a code include temp and blood sugar. That feels like an NCLEX question. All right, number 7 is someone needs to check their line access. Okay. Now I say number 7, but these things need to happen simultaneously, okay? So they need to be happening like one after the other. So number 7 is checking the IV access. Does their IV work? Do they have a central line? Flush it, make sure it's working, because if you need to administer epi, you do not want to delay that any farther than you need to, okay? You need to have a line and access. If the IV, you flush it, it infiltrates, start a new IV right away, regardless if you need to do epi or not. You need a line, okay? You need a line in a code setting or an almost code setting, okay? So number 7 was access. Number 8 is charts. Have one person with a WOW or cow or whatever you call it with the patient's chart open and ready to put in orders, okay? According to whoever's going to give the orders. And then number 9, of course, is who is giving the orders. So someone needs to call the attending doctor. Depending on your facility, maybe an ER doc will come, and or ARNP on your floor, who will be designated to run the code, to give the orders. Okay, every order that you're going to put in the computer is under my name. I want a portable x-ray. I want this, whatever it is. And then number 10, it's not necessarily a specific task, but I want everybody to stay put. So whatever role someone has, stay in that role until the end of the code. If you're recording and they're like, who's gonna pass meds? Don't stop recording, hand it to someone else, and then you do. Whatever role you're in, stay in that role for the entire duration of the code. And if you were that person, the nurse who delegated all these things, make sure that you tell people, you know, if someone tries to step out of their role, no, stay with respiratory, no, like, everybody stay in their role. It's going to run smoother. You're also going to have a less crowded room. And to me, that's the most annoying thing in a code, is when there's like 50 people and there's only really like 5 people working. I understand we need like a line for compressions if the code is really long, but we don't need 50 people. Everyone needs to just stay in their role so it's less chaotic. All right, so if you master delegating these 10 things, when a code is called and initiated, you will be fantastic. You will be set up, and of course, the patient is going to be set up for greater success, okay? All right, so I hope this helped you. If you're a nursing student, let me know. If you're a graduated nurse, let me know in the comments. I really love to know where you are in your nursing journey. And why don't you find me on social media? Let's be friends on social media. I'm on like all of the things, TikTok, Instagram, Facebook, all those things. And don't forget to check out my free resources on nursemegRN.com. I've got some free printables for you, a free report sheet, some NCLEX strategies, a pharmacology webinar, a bunch of stuff to help you out, because I really want there to be nurses in the future. All right, so thank you so much for watching. Let me know if you have any video requests in the comments, and I will see you on the next video. Bye.